Thank you. So it's 11 o'clock. We will get started. Thank you for attending our Medicare seminar today with the Mayo Employees Credit Union. We have people in-house here and we have a lot of people online joining us. Anytime during the presentation, if you have a question, if you're in-house, just raise your hand and be happy to answer questions as you go along. If you're online, if you want to enter it in the chat, and then we'll address those as we go along. So my name is Dave Brown. I'm with TrueLink Medicare Advisors. We are owned by the Minnesota Credit Union Network. So the Minnesota Credit Union Network is a nonprofit association that represents credit unions in Minnesota. We do advocacy work for credit unions and just a lot of different things, and that's who owns TrueLink Medicare Advisors. So any money we make from this, we put back into doing advocacy work for credit unions. So thank you for being here, and I've been in the Medicare space for 18 years now. Time flies, doesn't it? And so hopefully I'll be able to answer any questions you have, and with that, we'll get started. So disclosures, for those people in Minnesota, we offer all the Medicare Advantage plans and many of the standalone prescription drug plans and Medigap plans that are available, and then we are licensed in many states across the country, and we can offer plans to people in other states too, and happy to do that. Today is going to be a presentation on the basics of Medicare, and again, feel free to ask questions as we go along. So we're going to talk about why would you want to work with TrueLink, what is Medicare, what does it cover, what doesn't it cover, the different enrollment periods and deadlines, your costs that would be associated with Medicare, what if you're working past the age of 65, we get questions all the time, do I have to enroll in Medicare at age 65, or if I'm still working or my spouse is, can I delay it? We'll talk about that, and then we'll take a look at private insurance options. So once you get close to turning the age of 65, your mailbox probably fills up with mailings from everybody who wants to be your agent, and especially in the fall, you'll see about all that's on TV is Medicare advertisements, and call this number and we'll promise you the world. So Minnesota is a little unique than some other states in that some of the ads you see on TV, you're saying you can get all this free stuff. Well, that's true if you're on medical assistance and Medicare, or if you're in another state, they offer that. Not so much for Minnesota. So just saying, be a little leery of calling a phone number because they're promising you everything. If you work with TrueLink Medicare Advisors, there's never a cost for our services. We get paid a commission by the insurance carrier if you sign up for a plan through us. We're here to provide education to help you understand Medicare a little bit better. Like I said, we offer multiple companies and plan types. Medicare is not a one-size-fits-all. Some people prefer Medicare Advantage over Medicare Supplement. We're going to talk about the differences of those. And then we're available throughout the year for questions and assistance. And then every year there's an open enrollment period or an annual enrollment period where you can review your options for the following year if you want to. Having said all that, if you've been employed with the Mayo Clinic prior to January 1 of 2001, you may be eligible for benefits from a company called VIA Benefits, and your HR would let you know that. So if your employment started prior to 2001 with the Mayo Clinic, if you're eligible for benefits with VIA Benefits, you're going to get a subsidy to help you pay for your monthly premiums. But to do that, you need to go through VIA Benefits to sign up for your plan. We're happy to meet with you to help give you advice also. I just met with a couple of folks this morning who need to go through VIA Benefits, but they weren't sure about the advice they were getting, so we just help talk through that. But you don't want to give up. It's over $1,700 in benefits you'll get if you qualify for that based on when you were hired. You don't want to give that up. So again, we're happy to meet with you, but if you qualify for that, you'll want to go through VIA Benefits. So Original Medicare, there's two parts to Original Medicare. There's Parts A and Part B. Medicare Part A is for your hospitalization, and it would also give coverage if you needed skilled nursing for recovery, home health care, or hospice care. You don't have a monthly premium for Medicare Part A if you or your spouse has worked and paid into the Medicare tax for at least 10 years in the United States. Depending on the type of plan that you go with, you could possibly have a deductible of $1,736 this year if you went to the hospital. If you go with a Medicare Advantage plan, you don't have that deductible. Depending on the type of Medigap plan, you may or may not have that deductible. And then Medicare Part B, that's for your outpatient things like doctor visits, specialists, ambulance, durable medical equipment. And there is a monthly premium for Medicare Part B. This year, that's $202.90 a month. If you're collecting Social Security benefits when you sign up for Medicare Part B, that $202.90 will automatically come right out of your Social Security check. If you sign up for Medicare Part B prior to collecting Social Security benefits, they'll send you a bill where you'll either have it come out of a checking account every month, or they'll bill you quarterly to mail a check to them for that $202.90. Any questions on that? You need Medicare Part A and B to get supplemental coverage, either a Medigap or a Medicare Advantage plan. There are things original Medicare doesn't cover, so they don't cover comprehensive dental coverage. They don't offer worldwide coverage, hearing exams, vision exams, fitness benefits, or they don't cover outpatient prescription drug costs. That's why we'll go over the plans that will give you coverage for these types of things. So different Medicare enrollment periods. Your first Medicare enrollment period is a 7-month window based on your 65th birth date. So originally, around your 65th birth date, you have 3 months before the month you turn 65, the month of, or 3 months following to sign up for Medicare Part A and B. You do not need to sign up for Medicare Part B when you turn 65 if you or your spouse is still working and you have employer coverage. As long as the employer has 20 or more employees and they offer creditable coverage, and if that's the Mayo Clinic, they obviously have more than 20 employees and they offer creditable coverage, you can then delay enrolling in Medicare Part B until retirement. Whether it's you who have that plan or you have a spouse and you're on your spouse's plan, you do not have to sign up for Medicare Part B at age 65. So you don't have to be paying that $202.90 a month if you have an employer plan. You can wait until around retirement. So on retirement, there's what's called a special enrollment or a special election period. You would want to start about 3 months before. If you're beyond the age of 65, you want to start about 3 months before you're going to lose your employer plan and start the process of signing up for Medicare Part B. Not everybody signs up for Medicare Part A at age 65. You don't have to. There's really not a reason not to sign up for it unless you're contributing to a health savings account. Your question?
Yeah, okay. She turned 65 last month.
Mm-hmm.
She's going to retire again next September, October.
Okay.
Does she need to get Part A signed up for?
You can sign up for Part A now if you want to. You don't have to.
Because she's still with Mayo and still getting.
Yep. So if your Mayo plan, if you're contributing to a health savings account, you do not want to sign up for Part A, or you can no longer contribute to your HSA. Yeah. So if you...
But nothing will happen if she doesn't sign up for it in that 3-month window.
That's right.
Okay.
Yeah. So you can wait until retirement.
She can still sign up for A down the road.
And B, yes. Mm-hmm.
Okay.
Yes, you can. Yep. And that's your special enrollment period. 2 to 3 months before you're going to retire, that's when you want to start the process of signing up for Medicare Part A and B, if you haven't already done Part A. There's different ways to do that. We can help you with that, or if you go online, if any of you have created an account for yourself on the Social Security website where it tells you what your benefits are going to be if you retire at age 66, 67. You go to the ssa.gov, and then right at the home page there's a place that says sign up for Medicare. And you can do it that way 2 to 3 months before you're going to retire if you're waiting beyond the age of 65. Or you can go to the Social Security office and do it, or if you call us, we can help you. It's not overly difficult to do it online, but if you need help with it, we can certainly help you with that. And then every year there's an annual election period. That's October 15th through December 7th. And this is a time every year where if you have a Medicare Advantage plan, you can look at different options. If you want to switch for the next year, or if you have a standalone prescription drug plan, you can look at other options for you, because plans can change from year to year. If you have an Advantage plan or a Part D prescription drug plan, every year once you're enrolled in Medicare, that's the time frame you have to do that. And then there's also another enrollment period for people who have Medicare Advantage plans. Every year from January 1 through March 31st, if you want to, let's say you aren't happy come January, you aren't happy with the Medicare Advantage plan you have one more option the first 3 months of the year to switch to a different Medicare Advantage plan or to go back to original Medicare. Just a note, with the Mayo Clinic, in Minnesota, there are only 2 insurance carriers now that they will accept Medicare Advantage plans, and that's Blue Cross of Minnesota and Medica. As of December of last year, Via Benefits did not offer Medica plans, which is why the Mayo Clinic came out and announced, I don't know, it was October or November of last year, that for this year only, you do not have to go through Via Benefits if you want like a plan they don't offer, but you'll still get your reimbursement money. But the Mayo Clinic in Rochester will only accept Advantage plans from Medica or Blue Cross. The other downside to being in Olmsted County, if it's a downside, is this year Blue Cross, they have 3 Medicare Advantage plans for southern Minnesota, but in Olmsted County, there's only 1 option for you. With Blue Cross for Advantage plans, with Medica, you have 2 options. So if you're to meet with us, we're going to talk through the differences of Advantage versus Medigap, and you really want to think through, do I want an Advantage plan? Do I want a Medigap plan? And in the next few slides, we're going to talk about the differences with those, but just want to make you aware of if you qualify to go through Via and you wanted Medica, unless they get contracted soon with Medica, they're not even going to make that as an option for you if you want Advantage plans. But you may want a Medigap plan. So any questions on that? Probably went a little too far in the weeds on that and probably confused everybody. So delaying Medicare benefits. If you're going to work past the age of 65, we can compare costs with Medicare versus your employer plan. If you have insurance through the Mayo Clinic, keep what they're offering until you're ready to retire. It's going to be a better offering for you. Their plan is deemed creditable by Medicare. And again, if you have an HSA plan where you're contributing to a health savings account, do not sign up for Medicare Part A if you're the employee, or you can no longer contribute to your health savings account. When you are ready to retire, you're going to want to stop contributing if you have a health savings account 6 months prior before going on to Medicare if you're beyond the age of 65. As I said, you can apply for Medicare A and B online with the Social Security website. You can go to the Social Security office and do it, or you can give us a call and we can help you with that. There is a form that your employer will need to fill out for you if you're going to delay enrolling in Medicare. If you don't enroll at age 65, if you're 66 or older, there's a form your HR department will need to fill out for you. It's just a 1-page form, and this is what it looks like. It's request for employment information, and all this form is doing is verifying that you had employer insurance. And when you apply for Medicare Part B, if you're beyond the age of 65, you also submit this form, and that prevents any penalties for not signing up for Part B at age 65. There are income impacts when you go on to Medicare. Based on your income, there's something called extra help that's available to people who fall into the lower income category. And these are numbers for Minnesota for 2025. They won't have changed much for this year. They just aren't out yet. Across the top, you see the percentages. That's the percentage of the federal poverty guidelines. And then the column on the left is based on your family size. If your income, once you're retired, is going to fall below any of these categories based on your family size, you're probably going to qualify for extra help. If you qualify for extra help, it's going to help lower the price of your prescription drug plan, and it's going to help you with the cost of your prescriptions and so forth and so on. To apply, you would want to contact Social Security or go online and print off the form and do it online, but they're going to tell you if you qualify. You probably have a good idea based on income if that's something you would qualify for or not. The other side of that coin is if you're high income. So there's something called IRMAA, or the IRMAA, and this is for people who fall into the high income categories. And for this year, it's going to be every year the Social Security works with the IRS to take a look at your tax returns from 2 years ago. So for 2026, if you go on to Medicare this year, they're going to look at your modified adjusted gross income from your federal returns from 2024. And if you're an individual and your modified adjusted gross income was over $109,000 a year from 2024, they're going to add on a surcharge. And if you're married filing jointly and your modified adjusted gross was $218,000 a year or more, you're going to be paying a high income surcharge every month for the rest of the year, and then every year it gets reevaluated. So what that means is your Part B premium this year is $202.90 a month. If you fall into one of these income categories or ranges here, the next range means they're going to add on $280. You're going to be paying, your Part B premium would go up to $284. The most is going to go up to, at the very bottom, the highest income level, you could be paying almost $700 a month for Part B if you fell into that high income category. And then the Part D monthly surcharge, your prescription drug plan, they're going to add those amounts onto that premium also. And it's going to be every month for the rest of the year. And then every year it gets reevaluated. And at some point, if your income falls below whatever the threshold is for that year, you will no longer have to pay the high income surcharges. Any questions on that? Yes?
Both of you would be paying, like say you had made 218, both of you would be paying, if you're both on it, then you'd both be paying 284.10 a month.
Yes, yeah. And you can appeal if they tell you that you're going to have to pay the high income surcharge. They also tell you how you can appeal that. If it's just based on standard income that you've made, they're probably going to deny your appeal, but maybe it was from the sale of a house or something, or an inheritance or something, a one-time event that may have put you at a higher range. It's worth appealing it, and I've had people who've appealed it 2 or 3 times and finally got them to accept the appeal. But if it's based on a one-time event, you may have luck on winning the appeal and not having to pay that surcharge. If it's just from regular income, they're probably going to deny the appeal. So just wanting to let you know there is a process where if you don't think it's fair based on your circumstances, you can appeal it. Okay, private health insurance options. Any questions online yet? Okay. There are different options. There's what's called supplement plans or Medigap plans. There are Medicare Advantage plans, and then there are Part D prescription drug plans to go along with Medigap plans. We'll go over each of these. With Medigap or supplement plans, most states across the country, they're going to attach a letter to it like Plan G or Plan F or Plan N. In Minnesota, we don't call them that. They're called basic plans, extended basic plans. Some companies have a copay plan, some companies have a high deductible plan. With Medigap plans, with most of the plans available, there is no network. You can see any doctor across the country who accepts Medicare. They'll travel with you if you leave the state or you move to another state. You don't lose your Medigap plan in Minnesota. The downside to that is Minnesota has some of the most expensive Medigap plans in the country, so you may wish you could lose it if you move to a state where you could get one for half the price of what they charge here in Minnesota. But again, with Medigap plans, there's no networks. If you sign up for a Medigap plan, you don't have to worry about if your doctor's in network. As long as they accept Medicare payment, you're going to be able to go see them. With Medigap plans, it's your medical coverage only. It doesn't include prescription drug coverage, and if you wanted dental and vision coverage, you need to buy policies that cover those things. Medigap is just for your medical coverage. with Medicare Advantage plans, and in some counties in Minnesota, we also have what's called Medicare cost plans. But with Medicare Advantage plans, for your monthly premium, they include everything in one premium. So you'll get your medical, prescription drug, dental, vision, hearing, free gym membership, all that's included together in one plan. Medicare Advantage plans have networks. There are two types of Medicare Advantage plans in Minnesota. There are HMO plans and there are PPO plans. I encourage clients to stay away from HMO plans. If you go with an HMO plan, you're going to be more limited on what doctors you can see. You're going to typically need referrals. And when you travel, you're going to have less flexibility. If you go with a PPO plan, which is pretty similar to what an employer plan would be, you don't need a referral. You're going to have more flexibility. And the Medicare Advantage plans in Minnesota, if you go with a PPO plan, you're going to have national coverage with those. 97% of providers are in network. Excuse me. So if we talk about the two Advantage plans that Mayo will accept, Blue Cross and Medica, 97% of providers in Minnesota are in network. That's kind of a rarity, excuse me, in that, like I'm licensed in several states, and there are some states where if you go with an Advantage plan, you might be fortunate to find 50% of providers that are in network. But with Blue Cross of Minnesota and Medica, 97% of providers are in network, and then if you're traveling nationally, you're going to be covered across the country. The Mayo facilities in Arizona and Florida do not accept Advantage plans. They accept Medigap plans. They do not accept Medicare Advantage plans. The Rochester Clinic does with Blue Cross and Medica. But again, all your benefits are rolled together. You get your prescriptions, medical, dental, vision, hearing, all of that. Your network isn't a huge issue in Minnesota. Again, in other states, if you go with Advantage, it could be a big issue. You aren't asking any health questions when you enroll in a Medicare Advantage plan. Any questions on that? Okay. And then if you do go with a Medigap plan, you're going to want prescription drug coverage. Whether you're taking prescriptions or not, once you're eligible for Medicare A and B, you need to sign up for some sort of prescription drug plan. If you don't, and you do down the road, you're going to pay a penalty for the number of years you went without one, and that penalty is every month for the rest of your life. I meet with people who say, I don't take any medications and I never will, and that's your choice. So if you don't sign up you don't have to sign up for a prescription drug plan, but if you don't when you're first eligible and you wait until down the road and you do, then you're going to pay a penalty every month for the rest of your life because you waited to sign up for one. If you go Medicare Advantage, it's included with that. If you go with Medigap, you have the option of signing up for one or not signing up for one. But there are some inexpensive plans for people who aren't taking any prescriptions right now. I mean, you can get a plan this year for under $5 a month. And then if you sign up for a plan like that, then you don't have to worry about a penalty down the road. But every Part D prescription drug plan has what's called a formulary, and that's just a list of medications that they cover. And every plan is going to be a little bit different. If you meet with us, we're going to ask you for a list of prescriptions you're taking, and we'll look them up on the Medicare Plan Finder, and that's going to tell us which plans cover all of your medications, which ones may only cover certain ones, and so forth. Typically, you're going to want to find a plan that does cover all of your medications. They all have a mail order service available, and then there's different tiers of coverage. Tiers 1 and 2 are typically going to be generic medications. Tier 3 would be more brand names like Jardiance or Eliquis or Wegovy or something like that. And then Tier 5 would be if you had a specialty medication. Most of the plans aren't doing the Tier 6 anymore, but that would be the lowest cost generics. But again, if we meet with you and go over all this, we're going to be able to tell you up front before you ever sign up for a plan which one's going to work best for you. And again, as I said earlier, if you don't sign up for a plan, there's a penalty you'll pay if you wait until later, and you're going to pay that every month for the rest of your life. Any questions on that? Okay. So there is a maximum out-of-pocket on medications. This started in 2025, and this year that maximum out-of-pocket for your medications is $2,100. What this means is, with your prescription drug plan, if all of your prescriptions are in the formulary with the plan you sign up for, if you're going to reach an out-of-pocket expense of $2,100 for your medications, once you hit that, you no longer have to pay anything for your medications the rest of the year. I just met with a woman here this morning who, in 2 months, she was going to hit that max out-of-pocket because she was on some expensive medications. But once she hits that, you no longer have to pay for your medications. This is something new that started last year. In the past, once you hit, there was something called the donut hole or the coverage gap. Once you hit that, you had to pay 25% of the cost of your medications. That's gone away, and there's this new threshold to where if you're on expensive meds and you're going to hit that cap, it's a way to help you with your expenses. And for some people, they hit it in the first month or two, and to come up with $2,100 for some people when you're retired can be difficult. So every prescription drug plan for Medicare has to offer you a Medicare prescription payment program. And they'll send you the information automatically. You don't have to request it. I get calls all the time. Do I have to sign up for this? No. It's only if you want to. If you sign up for the prescription drug plan, it will spread your costs out over the whole year instead of getting hit and having to pay that $2,100 in 2 years. They'll spread it out over 12 months. And then when you go to the pharmacy, if you sign up for the prescription payment program, you won't pay anything at the pharmacy for your medications. Your insurance company will bill you every month for your medications. Something new again. Yes?
We just have one question coming online. Can you restate which plans are not accepted for Mayo, Florida, and Arizona?
Yeah, so the Mayo clinics in Arizona and Florida will only take Medigap supplement plans. They will not take Medicare Advantage plans. The Mayo Clinic in Rochester will accept Advantage plans from Medica and Blue Cross of Minnesota. And then your costs. So kind of as a recap, you know you won't pay anything for Medicare Part A. Part B premium this year is $202.90 a month. If you go with a Medicare Advantage plan, in Olmsted County, they're going to run anywhere from $47 up to $250 a month. And that's everything together, your medical, prescription drug, dental, vision, and hearing. If you go with a Medigap plan, you'll still have the same premiums for Medicare Part A and B. But if you go with a high deductible plan, that's going to run about $75 a month. That's where you pay the first $2,800 in costs, which I don't think they're a good deal, but they're an option. Or if you go with a basic plan, or what would be comparable to a Plan G in Minnesota, those are going to run over $300 a month. But with that, you pay a deductible of $283, and then you don't have any co-pays after that. You would add on a Part D prescription drug plan. Those can run anywhere from $5 a month up to over $100 a month. But again, if you choose to meet with us, we're going to look those up for you so you know exactly what your costs would be. So Advantage plans can be more economical on monthly premiums, but you're going to have co-pays with those plans. If you go with a basic plan with the riders in Minnesota, you won't have co-pays. So it's kind of hashing out what you think you want to do, and that's why we meet with people individually to help you decide what's going to work best for you. Any questions on that? And again, Medigap plans in Minnesota, the ranges we have here are higher than you're going to see in most other states. But again, Minnesota's Medigap plans are what's called community rated, meaning whether you're 65 or 85, you're going to pay the same monthly premium. They do, if you're a smoker, you're going to pay more than being a non-smoker. In Wisconsin, they have age-rated plans, meaning you'll get a plan for about half the price at age 65 in Wisconsin, but the older you get, your premiums keep increasing because they're based on your age and not on everyone as a whole. So it just depends on what state you live in, whether it's age-rated or whether it's community-rated. Okay? So any questions with that? Normally I would have what's called a permission to contact form. We're having all of our materials redone, so I don't have that, but you have my business card, and if you're online, the Mayo Credit Union will send out those attachments for you. But any questions on anything I talked about? Hopefully I didn't confuse you more than when you came in, but. Any questions online? No? Be the easiest group I'll have all year. Yes.
So Part C, does that cover vision and dental, did you say?
Advantage plans cover vision and dental, yes.
So, I have another question.
Mm-hmm.
I have a friend whose daughter works in finance for Mayo,
Mm-hmm.
and that person told her parents that you don't need any supplements, that if you have Medicare, say, if you have Medicare and you have, say, your knee done,
Mm-hmm.
you get the bill, you get paid, you don't have to pay for anything. But if the same person had Medicare and had a supplement, they would charge more because they know that you have Medicare and a supplement. You know anything about that?
Yes, and that's totally off. So
Okay.
if you just have original Medicare, let's say if you go to the hospital, you're going to have a deductible of $1,736 that you're going to have to pay. If you were readmitted to the hospital within 60 days from being released, you wouldn't have that deductible. But if you had to go back to the hospital that year, 60 days or more after being released, you're going to have to pay that over $1,700 deductible again if you just have original Medicare. For the Part B, you'll have a deductible of $283 when you go to the doctor or have an ambulance ride, whatever that is, and then you're going to be liable for 20% of your costs, whatever it is. There's no maximum out-of-pocket protection with original Medicare. So if you have major medical bills of $500,000 and all you have is original Medicare, you're going to pay 20% of that. So the reason people sign up for supplemental or Medicare Advantage plans is they cap your costs. Medicare supplement plans, if you go with the basic plan with the riders that are available, you pay the $283 deductible. That's all you pay for the rest of the year. You don't have the copays. With Medicare Advantage plans, you don't have a medical deductible, in Minnesota plans at least, but you'd have copay. Say if you went to the hospital, you'd have a $200 copay for your hospital stay. If you went to a specialist, you might have a $30 copay for that. So Medicare, in terms of the insurance company will bill you, or makes whatever their comment was, if you're in the medical profession, you know that Medicare reimburses providers at a lower rate than what your company insurance does, but I'm not sure what they were talking about.
Well, she totally confused me. I'm like, that made sense to me.
No, you're really putting yourself at risk if you just have original Medicare Part A and B and no supplemental kind of, even if you went with a low-priced Medicare Advantage plan, you still have what's called maximum out-of-pocket protection, to where if you had X number of dollars you paid in copays, if you reach that level, you no longer have copays the rest of the year. If all you have is original Medicare, you put yourself at risk of 20% for whatever your expenses are. And there's no cap.
Okay.
Yes?
On a supplemental, will it now, once you start paying off through Social Security? Because they take it out of your Social Security, right?
They take Part B out of your Social Security if you're collecting Social Security.
Okay.
And depending on the carrier, if you want your monthly premium, you can either get a monthly bill or it might come out of your Social Security,
You can get it so they take it out of Social Security?
depending on the carrier.
Supplement?
Depending on the carrier you go with.
Okay.
Yeah. Mhm.
So,
Yes.
Question. So is it true that, say, if you have Medicare A, B, and D or whatever it is, every time, like, if I go to my primary doctor, there would be a deductible? Or is that?
So if you have,
Now, if we go to preventative, it's free,
yeah,
basically.
So-
Unless the meds and stuff like that.
right. If you go with a Medigap plan, again, the basic plan with, you pay that $283, you're going to hit that the first time you go to the doctor. After that, you're not going to have any deductibles or co-pays the rest of the year. That's with a basic plan in Minnesota. With an Advantage plan, you don't, the two that Mayo accepts, you still don't have a medical deductible, but you'd have a copay. Primary care doctors, you don't have a copay on those plans, but you would on a specialist. And copays, you're talking maybe anywhere between $30 and $50. If you don't sign up for a Medigap plan when you're first eligible and down the road you want to, you're going to go through underwriting, and if you answer yes to any of the health questions, they'll deny you coverage for your getting into a Medigap plan. There's an exception for that, and a big thing that happened in Minnesota this past year was UCare announced they're going out of business. And 185,000 people in Minnesota had UCare, Medicare Advantage plans, and I worked with a lot of them. Because they lost their plan against their will, that gave them the right to switch to a Medigap plan if they wanted to without any health questions being asked. And a lot of people did in this area especially. But so if you have a Medicare Advantage plan and you lose it for whatever reason, like United Healthcare cut back on a lot of counties, if you lose your plan, if it's a Medicare Advantage plan against your will, you can sign up for a Medigap plan without being asked health questions. A lot of people don't know that. Or if you already have a Medigap plan and you wanted to try out a Medicare Advantage plan, you can do it for 12 months. If you like it, you can keep it. If you didn't like it, you can go back to the Medigap plan you had at the end of 12 months. Yeah, so there are different options that are available for people. I don't know if I have my contact information here. I don't. Well, you have my cards, but yeah, if you if you have specific questions you want to ask, you can certainly reach out. My phone number or my email, texting, whatever works for you. But if you want to schedule a time to meet based on when you're going to be retiring, we meet people right here at the credit union. If you qualify for VIA benefits, ultimately you're going to want to go through them, but we can help advise you on that too. The person I met with a person this morning who VIA was telling them to go with a certain plan, and I said, well, did they explain to you, if you go with that plan, you don't have preventive coverage? Oh no, they didn't tell me that. So, you know, it's good to get a second opinion, I guess. So, yes, Christian.
If you go with a Medigap plan, do some of the supplements include vision, dental, etc.? Or are those only covered with a Med Advantage plan?
So if you go with a Medigap plan, some of the companies will offer you discounts for like eyewear or dental. But if it's vision for, like you're seeing an ophthalmologist or something for specialty, your Medigap plan will cover it. If it's eyewear allowance and all that, or dental, Medigap plans do not cover that. And Medicare Advantage plans do.
So what does, sorry to interrupt. So what would not work with Medicare?
Medigap, you're not going to have any eyewear coverage. If you needed new glasses or contacts, you might get a discount on that depending on what plan you signed up for. Medicare Advantage, they do cover that. And with Medicare Advantage, your annual eye exam, there's no copay for that, at least for the plans in Minnesota. And they all offer an eyewear allowance if you need to get new glasses. They all offer some sort of dental coverage. Some plans are better than others. If you're in Arizona, I've worked with several Mayo retirees in Arizona. Arizona does not have great Medicare Advantage plans. Most of them are HMO, they're zero premium, they don't travel well if you come to Minnesota. They work well for people who stay in Minnesota and want to see the same doctors, but there's just huge differences in Advantage plans from one state to the next. Minnesota probably has the best options for Advantage plans anywhere in the country. Some states do not have great options for Advantage plans. South Dakota, they have Advantage plans. The Medigap plans are probably every bit as popular in South Dakota because their rates are so much lower than what they are here in Minnesota. But the nice thing in South Dakota is if you got a Medigap plan, you can go to any provider that you want to. The Advantage plans in South Dakota are a little more restrictive on who's in network and who's not. If you're in Sioux Falls and seeing Sanford, not going to be an issue, but if you're out in Rapid City or Mitchell or somewhere, it could be a bigger issue with an Advantage plan.
Doesn't matter if you're living part-time in South Dakota and part-time in Minnesota.
So wherever your permanent residence is, it would be where you are. So yes, it does. So Blue Cross would have, if you have an Advantage plan and you're in South Dakota and want to use it, you'd need to be within the Blue Cross network. With Medica, once you're outside of Minnesota, anybody who accepts Medicare will accept your Medica Advantage plan. So it's different from one carrier to the next.
How about if we start here on the Advantage, but then we move to South Dakota?
Yep.
Say in 2 years.
Yep.
Are you able to switch to the Medigap then?
You are. So if you Medicare Advantage plans are based by county within a state. So if you moved from Minnesota to South Dakota, you're going to lose your Medicare Advantage plan here, which gives you the right to sign up for a Medigap plan in South Dakota because you lost your plan against your will, and you can sign up without any health questions being asked. Yeah.
And there's no penalty.
There's no penalty. Not that Medicare's complicated or anything, but. Any other questions? Well, I'll be around afterwards. I'm not going to shake hands because I'm just getting over a cold. You can probably tell that. But thank you for coming. And if you do have questions you want to ask me afterwards, I'm happy to answer them. But appreciate you coming. Thank you.